Hi, my name is Dominic Quagliozzi. I'm here at the Open Door Art Gallery inside the Worcester Art Museum with my show Homebody. With Homebody, I wanted to kind of explore my roots as someone from Massachusetts, Worcester specifically, and also the experience of being chronically ill and disabled as a child with cystic fibrosis, spending a lot of time in the hospital. The hospital kind of became my art studio. It was like the first place that I started drawing, the first place where I started painting. Actually learned how to paint by watching Bob Ross in room 555, which is the first painting in the show. The title kind of grew organically out of just the themes within the show. My experience with my own body, being ill and various levels of debility throughout my life. Sometimes I would have the ability and energy to make larger paintings, and then you scale that way back when I was feeling sick or waiting for a double lung transplant, or I didn't have much mobility, much strength or energy. So I kind of did a lot of performance art and things with my own cell phone and things. And then also I recently moved back to Worcester after living in Los Angeles for 15 years. So it was like this return to home as seen through the lens of my body experience and my experience with the medical community in Worcester, how I was brought up at UMass and then returned. So it was like this kind of synergy of those two ideas. I think experimentation is the main driver of my practice. I'm just constantly looking for new materials and new ways to make art. As you walk through the show, you see traditional painting in the beginning, then you see some traditional painting with added elements of hospital materials, like the IV tubing, the oxygen tubing, and the nitrile gloves, graphite drawings, and then you see the video work and performance work. But you also see a lot of hospital gowns. And I think specifically I like to work with materials that come out of lived experience situations. If I'm in the hospital and I'm having a procedure or something, I source the materials from those actual experiences. And I think that kind of reflects back on my experience of being a patient from birth. I was diagnosed with cystic fibrosis at 3 months old, and just throughout my life, I was part of a lot of experiments and trials for different treatments and cures for CF itself. And that kind of just really influenced and impacted my art practice, like constantly seeing what these materials can do. Can they kind of be substrates for actual art materials, like the hospital gowns as a substrate for paintings? Instead of canvas, use the hospital gowns. And then I got involved in sewing in the last 5 years, making these wall hanging works. And as you get closer, I leave little pieces revealed that they are actual hospital gowns, and you can see some of the patterns and stuff. And a lot of people have said to me, I was sick once, or I had a surgery and I wore that gown, or a family member was really sick and had open heart surgery and they were in that gown. And it brings back all these different feelings and memories, and that's kind of important to the work itself, to kind of bring that up. The sensation to want to touch those and drape is there. And so I wanted to kind of think about that. But specifically for the Transformer pieces, those came in a dream. I was trying to prepare for another body of work. I had this dream where I was opening up this painting like cabinets and drawers, and I said, well, let's explore that. So it kind of started with the wood structures, and then I added wrapping them in the hospital gowns, and just thinking about this manipulation of patients in the hospital setting, and how a new person comes in the room, a nurse, a doctor, they touch and look and examine and gaze, and then they leave, and I'm left looking or feeling differently. And so I wanted to bring that option to the viewer, where they can see the work on the wall, manipulate it themselves, and then leave it, and then the next viewer comes in and the piece was affected by someone else other than me. They have this relationship to a body. The arms and legs feel like arms or fingers or however they move. So I think for this specific show, I really want the viewers to get that sense of history throughout as they walk through, seeing like almost like the origins of my artistic practice and career, from just being like a kid in high school, learning how to observe the world around him and document it, through experimentation, documenting it in different ways. Because I was a patient so early and I was in the hospital so much, I had those moments of like solitude where I could think and kind of remove myself and kind of see myself in a space like a studio, like an art studio. Although like the last 9 years I'm post-transplant, I'm not in the hospital as much, maybe once a year for a couple of days. So I am transitioning in that sense, but I think having the history and being able to see the development and see the through lines from the first work to here, that my experience with chronic illness and disability has been matched with the creativity of expressing that.